you, Cecilia. Thank you, Halinta. Hi, everyone, and good day. Thank you so much for joining us today. And I want to, first of all, on behalf of my team, thank Cecilia, who met with Rachel and me, I think a while back, and many thanks to Halinta and her team for organizing this. My name is Isang Awa, and I lead the work of disseminating the parenting resources in West and Central Africa. I'm here today with many of my colleagues, Rachel, Lara, Leah, Bridget, and so many others. Sorry if I can't get through to everyone. And they will all join in the discussions after the presentation. And I know that we have relatively short time, so I'm going to try to be as fast as possible, hopefully, so we'll have enough time for discussions and questions at the end. Our presentation today is on the COVID-19 Playful Parenting Emergency Response, which is a set of open access parenting resources that was created by Oxford researchers in partnership with UNICEF, World Health Organization, the Global Partnership to End Violence Against Children, USAID, and other international organizations. And right here, oh, I should have started here, sorry. And right here, I have the presentation outline. Let me see if I can briefly touch everything. Caregivers matter too. Impact of parenting programs, our mission, COVID-19 Playful Parenting Emergency Response, available parenting resources, reach through partners, global reach through numbers, impact stories, corporate team, contact details, questions, and discussion. Caregivers matter too. And I just want to use a little minute to explain why this is so important. So there's evidence that the early life experiences powerfully shape children's development in key areas. And that makes the nurture and care that they receive from caregivers a critical ingredient in their development. And for caregivers to give nurturing care, they need to be physically healthy and emotionally well, because if they're anxious or stressed or depressed or unhealthy or worried, it will lead to a range of negative outcomes for the children, including poor infant growth, emotional and behavioral difficulties. And for this reason, efforts to support children must include promoting caregiver health and emotional well-being. And a key way to promote caregiver health and emotional well-being is through parenting programs. So parenting programs, for those who may not, but I assume everyone here is familiar, but I just want to say parenting programs are programs that promote positive parenting skills through social learning theory. That is to help parents and caregivers to learn the skills that they need to deal with challenging behaviors. And even though I may not always add caregivers, if I use just parents, please just assume that I'm making reference to both parents and caregivers, because we realize that in many homes, it's not just the father or the mother that is the primary caregiver, but sometimes relatives like grandparents. And impact of parenting programs. Sorry, there's an echo, but one. So here on this slide, we have some of the impacts that, impacts of parenting programs and there's evidence that they reduce violence, improve responsive caregiving, improve mental health, reduce substance abuse, improve employment and education, reduce intimate partner violence. And you can see here on the right-hand side, a range of some other outcomes. So they are and all of these are based on studies. So parenting programs can really, really help to make a difference. And so we realized that with the COVID-19 pandemic and the lockdown, that many parents worldwide are going through so much anxiety and stress, and that more than ever in this period, parents and caregivers need to be supported. So our mission is to help parents and caregivers of children and adolescents with open source, evidence-informed parenting resources. And in response to the lockdown and the anxiety that parents worldwide must be facing, or are facing, in partnership with UNICEF and other international organizations, I did mention some of them earlier, we created a number of open source resources some of them, and in a minute I'm going to in detail speak about them. You can see them here. These resources are open source, they are evidence informed, and they come in very simple language that is easily understood by people everywhere, and they're very, very clear. The messages are clear, they are affirming and positive, and like you can see from some of the illustrations, they come in colorful illustrations that make them very appealing to people. In later slides, I will also show how they have been used and are still being used in some West African countries and Central African countries and in other places as well. And right now, I'm going to briefly talk about some of the resources that we have. I may not be able to touch all. So the first one I want to talk about is parenting tip sheets. We have a total of 15 different parenting tip sheets. And on this slide, you can see 3 different tip sheets. The first one is take care of yourself. I did say earlier that, you know, there are really, we use simple language that is so easy for people everywhere to understand. And the tips are just very easy to understand as well. You can see here, talk to someone when you feel lonely. Take 5 deep breaths when you feel stress or anger. We usually say take a pause. You're not alone. Then there's another one, praise your child when they are behaving well. Say the behavior you want to see. I did mention we have 15 in all. So we have one that also talks about parenting in crowded homes and crowded communities. There's another one for parenting children with disabilities. We have one for family budgeting in financial when you're going through financial difficulties. We have so many others. There are 15 in all, and each one is so different, focused on a specific message. Then, additionally, these parenting tip sheets have been translated into 90 languages so far, including French. So we have all of this in French. And I think I also want to mention that on the website, you can see the languages, and if you see that there's a language that is predominantly spoken where you are or where you work, and we haven't translated into that language yet, please reach out and let us know, and we'll be happy to work and get this address started so that you can have the parenting tip sheets in the language you use. Then we also have tips for caseworkers. Again, I have shown a few here. So these tips will help caseworkers identify families that are at risk and give parenting support. Once again, they are simple, they have clear messages, and the messages are very affirming. They come in a number of languages, including English and French. And here are some other resources we have. We have public service announcements, and this is very popular. A lot of local NGOs use this, especially in places where they may not have access to television or radio, so they use that. We also have radio scripts, and many times they are translated into the local languages and used on the local radio stations there. We have social media toolkits, which our partners are using on their different social media platforms. And we also have packs for religious leaders. Under the packs for religious leaders, right now we have completed the Pastor's Pack, and work is ongoing on the packs for imams and leaders of other faiths. So in the next few weeks, we should have all of that ready. So we are also using, the religious organizations to get through to parents, to reach families and share these resources. And I want to take a moment and talk about this. So we haven't launched this yet, but we are almost ready to launch this parent text. And what is so, I'll say a few things about this. So it uses a software called Rapid Pro, which is also used by UNICEF. And basically, what Rapid Pro does is it sends daily parenting messages to those who have registered on the platform. And it sends daily parenting messages on phones. This can be sent on basic phones and on smartphones. So you don't have to own a smartphone to use this. And that means parents in rural areas everywhere can receive this. The messages could be text messages that people read. They could also be audio, and they could also be video. And even if you have a smartphone and maybe you're worried about your data, that, if I use video, I'm going to run out of data so soon, you can sign up to be getting text messages. So you get these messages every day. for 5 weeks. And even when you have received, the text message you want for the day, or, should I say your daily quota, you can still sign in, because if you have a smartphone, you can use the software either on WhatsApp or Telegram, and you can interact with it. There's a chat bot there that you can use to interact. So even if you've received a text message, you could still sign and get more information. Maybe there's something in particular that you need information on, so you could still sign in and get additional message. I'll be happy to share more about this during the discussion. Then reach through partners. So presently, we have been working with different organizations, and I really want to talk about the work we have done in West and Central Africa and in Africa generally. So we have local NGOs and CSOs, like in Cameroon, we've been working with Sospidium with ZIGSTEC as well. In Ghana, we have Youth Earth Initiative and other organizations. In Malawi, we have the PSA broadcast through Blantyre Synod Radio. And so far, it has reached about 8 million listeners. We also have our partners using their social media platforms to send messages. Like in Kenya, we have the mHealth platform has been used to share bulk phone messages to people. So people get, I think so far over 26,000 people have been reached with that. We also have phone calls in Kenya, and in South Africa, we have information that they've broadcast this to about 15 different radio stations so far. Then we are working with World Without Orphans, and through World Without Orphans, we're getting these resources across to leaders of faith and faith-based organizations, including in Africa, not just worldwide, but in Africa as well. And we are also partnering with the Internet of Good Things across sub-Saharan Africa. And with these, people don't need to have any data cost. And I'd like to talk more about this, but I think I'm going to suspend that maybe till later on if there's time to discuss this further. But I have put the contact details of Laurie Markle, who's in charge of Internet of Good Things. Works through is a platform that allows people to receive free messages in case anybody here on the call would be interested in finding out more about Internet of Good Things. Then with our NGOs and CSOs, we also have people doing house-to-house printing resources and sharing, and through community, they train volunteers who also take these resources and share from house to house and through different avenues as well. And so far, we have been able to reach over 78 million people worldwide. You can see the reach here on this slide. In Asia, over 12 million. In Europe, a little under 1 million. And in Africa alone, we have been able to reach over 15 million people. Now, I'm really excited by the number, but at the same time, I think it's a huge number, and it's really exciting to see this. But when we think about the number of people that live in Africa, or even in the world, we realize that we haven't yet scratched the surface, and there are so many, many other people out there that we need to reach out to and support with these parenting resources. I'm not sure how much time I've got left, but I'm going to try and rush through this. I just want to share 2 different stories here. I hope you can read it, because I'm worried about the time, I'm not going to read through. But the first one is from a single mother of 3 boys who lives in Cameroon in Central Africa. So through the NGO, the tips were shared with her, and she came back after a while and talked about how much it's helped her and helped their family. The second story there is from a father in Ghana, and he's written about, again, it was shared through, the resources got to him through an NGO, a local NGO in Ghana that we are partnering with. So again, it's made a lot of difference in his life and in the lives of his family members. These stories remind us, I think these stories remind us of 2 things: that there are so many people out there who need this, and 2, that what we have is impactful and can really make a difference in the lives of people, in the lives of families. And right here, we have the contact details of our team members: Jamie, Rachel, Sabine, Lara, Bridget, Laurie, and okay, that's my name there, Isan. You know, please feel free to reach out to us, ask questions. I mean, even if right now you can't think of anything you want to say, but when you leave here, you remember, oh, I'd like to find out this, or I have a question, or there's something I'm not sure about, please feel free to reach out to any of us at any time. I'm going to skip this, but I'll get back to it in a minute. I want to share this slide, and in appreciation of all our amazing partners and funders, because we are only able to do the work that we have been able to do because of the support, the amazing support that we have received from so many partners and funders. And so I thought I should share this in appreciation. And we are hoping that we're really looking forward to partnering with all of you here, working closely with you to get this across to families, to homes, to parents, to caregivers, to caseworkers, where in your locality. So I'd like to get back to the slide I skipped. And right here on this, we have some questions that we have framed that we would like to know. You know, do you think these resources might be useful in your context? What stands out as helpful? There are other questions there. And we want to hear your ideas, but we want to hear your questions too. So please feel free to ask us questions. Thank you so much, everybody. Thank you.
Thank you so much, Ethan, for the quick presentation. Very rich and interesting. We already have some questions in the chat ongoing. And I've seen Rachel responding to some of them.
Great.
This is Rachel. Maybe, Rachel, do you want me to give you the floor?
Yes,
responding to some of them?
Let me stop share.
Because we have, yes.
I'm happy.
Just to remind that the discussion session will be in French, both French and English, and just for colleagues to feel free to ask their question in French if they prefer, because you have a colleague speaking French and we can also support in responding to them. Over.
Lovely. Hi, Helena, thanks for the floor, and thanks Isong for your beautiful presentation. I'm also very happy for you to jump in and answer questions. I just was trying to answer a few quickly as you were going. Maybe we can take some together, Isong.
Sure.
I saw one question about, do we have a tip sheet on gender socialization issues? And it's such a great question. We don't have just one tip sheet that looks at it, though when we wrote each of the tip sheets, we did try to do it while keeping in mind the importance of using gender open language and thinking of activities that are for children that are not overly gendered. We also are making an effort to engage both men and women as caregivers, and you can see that in the imagery of our bubble people. They're non-gender specific intentionally, and in our parent text work, our work with parents over text message, we're including specifically messages on gender equity between involving men in caregiving and household work as well. I hope that answers your question, Cecilia. That was a great question. There was a question from Koku about ways of reaching illiterate parents. And Isong, feel free to jump in. I would say it's primarily been through things like audio broadcast, either over radio or loudspeaker announcements. For example, in Thailand and villages in Thailand, community leaders have used loudspeakers to make announcements at the community level for parents to listen to. We do have illustrated comic strips that illustrate some of the key messages in the parenting tip sheets, but they are intended still for people who have some literacy, some ability to read. And our all of the parent text, the text message support for parents, it can include either written text messages or audio and video messages, so that parents who are illiterate can engage with it. And also because we find that video content is really compelling to a lot of parents. Isang, do you have anything to add on that question?
No, I think you've answered it. Yeah, because in many of the rural communities, so they use the loudspeakers and share the messages. Yeah.
Yeah. I see there's also been a question about what's the reason for reaching fewer families in the Mideast and Europe and the Americas. It's a great question. I think some of it is related to where our existing partnerships that, yeah, go ahead, Isang, do you want to speak to that?
I think it has to do with where we have partnerships, where we have partners. And so that's really it. We're still working on that.
And some of it is also just population size, is where like doing some radio work in Pakistan and some work with government in Bangladesh, you very quickly have access to large numbers of children in Asia, where in Europe, for example, where family size is much smaller and populations are lower, you're reaching fewer children, even if you're doing more engagement in the region. But we are making a concerted effort now to do some continued outreach in areas where we've done less before. Isang, the next question is a great one for you about languages we've used in Ghana and Cameroon.
Yes, so far we've been using English, but we're working on translating into Pidgin. So as a matter of fact, so one of the partners there, they've been working on the translation into Pidgin English, and that's what we've been using so far. So in the areas that we've been reaching out to people in Cameroon, I do know that, I know that we also have those who speak French, but so we already have the translations in French already, but we're working on translating the tip sheets into Pidgin as well, because that's another language that they've told us they use predominantly there.
And just to add to that, oh, go ahead.
I think that my colleagues from the C4D team are connected, but I think that one of the requests, as I told you during the previous exchange, will be for us to see also how the tools could be translated in some, like the most spoken local languages in West and Central Africa, as you did for WCARO.
Yeah.
Thank you.
Great, thanks for bringing that up. And it relates well. We are able to offer some translation support. So if you think these resources would be useful in your context, but we don't yet have a language that you would need it in, I see Isang shaking her head. Yes, we can help support with translations. We also have been engaging translators to make Hausa and Twi language resources available. It's been a bit of a slower process. So if you have an urgent need for those resources and know someone who's able to help us with that, we might be able to go through a different avenue. But in all cases, if there's a language we're missing that you'd like us to use, feel free to contact Isang or any of the contacts in the end of the PowerPoint to let us know about your language requests, and we can do our best to make something available.
Rachel, can I jump in? This is Sabine.
Yeah, hi Sabine.
Hi everyone. This is Sabine from the Global Partnership. Just two things. One, there was a question about monitoring, and I think what's really important is that we have evidence, as Isang really well outlined, on working with parents in group settings. And so we're now working at very different levels. So it's general population messaging, text messaging, WhatsApps, public service announcements. And so we're trying to set up monitoring systems so that we can evaluate whether these different means of delivery will result in the same decrease in the prevalence of violence against children. So that's a whole new field that we're embarking on, because it's not, we know that COVID will mean that we have to keep social distancing so that the traditional in-person delivery or in-group delivery of parenting won't be possible anymore. So anyways, we need to develop these new tools. And so we're going to set up evaluation processes. Mais en fait, j'aimerais beaucoup que entendre de votre part ce que vous faites dans les pays et ce que vous pensez encore faire en termes de la dissémination et de travail avec les parents. Pas nécessairement en utilisant ça, mais plus généralement, dans vos pays, qu'est-ce que vous pouvez faire? Parce que ce n'est pas le but que nous, on parle tout le temps. Le but, c'est vraiment de vous entendre et que nous, on puisse répondre à vos demandes.
Merci Sabine, c'est un bon point. Peut-être que je vais juste laisser Rachel répondre à quelques questions quand même qui sont revenues. Rachel and Isang, maybe you can talk about how the tools have been relevant for frontline workers, because we have a specific question for relevance of the tool for teachers, but maybe more broadly, because you said that you have developed something for case workers, maybe not only, I don't know if it's only for health community workers or it's for all of the caregivers like working with children. Then it will respond to the question related to teachers. And yes, and we will maybe start talking about what we are doing in WCARO and how it will be relevant for us. Over.
So the tip sheets that we have, the one for caseworkers, whereas they are not, so I should say this, we didn't specify that we don't have specific ones for teachers or for those in health in particular areas, but they're very simple and there are things, there have tips that could be used by anyone in any context. But additionally, what we do is when we're working with partners, if they identify areas that they would need support, like training, we plan and do organize and give that to them. Rachel, do you want to jump in and say anything else?
Sure. I think just to add, I see there's been a question about, are these resources potentially also relevant to teachers? And I think to add that although they were written with parents in mind, many of our partners are finding that they're useful to teachers as well, because the same advice about how to manage stress, how to speak with children, how to engage children can be relevant to teachers, although they weren't our primary target. And some of our resources, we do have resources meant for community workers to identify vulnerable families who are more at risk. And oftentimes in countries that might be done by a social workers or a social worker equivalent, but they could be used, for example, by teachers in a context where that's who might be ready and able and willing to engage in that work. And I think I can give a sneak peek to this team to say that we are working on a tip sheet designed to support parents around home learning, but that might also be more relevant for some of the teachers as well. It's not yet public information, but just to let you know that's coming if it's something that would be helpful or interesting to you.
I see a question here. I don't know. I hope I haven't skipped any question.
Well, maybe just to say, I think there's a good comment from Helena, just for time management, maybe Isang, if you can facilitate the discussion around your questions for colleagues, and I can try to respond to some questions in the chat while you go, so there's time to get to everything. Is that okay?
Sure, but I just want to add, for the person who asked about tips for dedicated to parents with disabled children, yes, we do have that. So we have a tip sheet that is just dedicated to parenting children with disabilities. So I'm sharing, do I have can I share my slide again? So I have this on questions and discussions. So we have some questions framed here. Do you think any of these resources might be useful in your context? If so, what stands out as helpful? How would you disseminate them in your context? What platform would you use? And what would be challenging about using these resources in your context?
Yes. Okay, I will give the floor to the colleagues. I'm seeing colleagues from Mali, DRC, Nigeria, Burkina Faso connected.
Hello, Alinda.
Yes.
This is Burema from Bamako.
Yes.
Hello, everybody.
Hi.
I will shift in French, so my French-speaking colleagues will be understanding what will be saying fully. Bonjour tout le monde, bonjour chers collègues. Concernant cette thématique, comme vous le savez, le Mali avec l'équipe de partnership on a travaillé sur un kit de parenting pour les employés des entreprises privées en collaboration avec le patronat malien. Donc, ce kit a été développé avec l'appui de WCARO, l'équipe à qui je dis merci. Donc, ça a été partagé largement et ça a été utilisé dans le cadre du COVID justement pour aider les parents durant le moment de confinement qui étaient à la maison de pouvoir assurer une communication, un dialogue, un suivi de leurs enfants. Donc, ça, c'était l'expérience que je voulais partager pour dire que la thématique d'aujourd'hui est une thématique très importante qui devrait se poursuivre également. La question de lier cela aux enfants avec des handicaps est très importante. C'est une question qui souvent est passée inaperçue ou est prise moins en considération parce que le nombre d'enfants dans cette situation n'est pas assez important dans la communauté, mais ça reste quand même des spécificités qu'il faut prendre en compte. Donc, je suis content d'entendre parler de cela ici. Merci.
Merci beaucoup, Burema. I think, do you want me to translate?
Yes, please.
So, oh, Burema peut le faire. Hein? So he said that in response to the COVID-19 pandemic and during the lockdown, UNICEF has partnered with private sector to develop a parenting package, like and tools that they have broadcasted. I don't know, maybe he will give more details in the chat or who they have been targeted and how it has been disseminated. But this is what they have done in response to the COVID-19 because they felt and they believe that they were in need to support parents coping with stress during this lockdown period in Mali. And he said that for them, he's happy to hear that you have developed something to support children living with disability because it's also something that is generally neglected in our programs, and it's really relevant for the program's implementation too.
Thank you. Thank you.
So I don't know if quelqu'un d'autre veut intervenir. Sinon, moi, je voulais demander à Burema, quels sont les outils que vous avez utilisés pour ce parenting et comment... OK, Juan? Juan, vas-y.
Thank you, Alenta. But maybe not if you want to continue with maybe digging with the country offices, and I wanted to bring the regional perspective, but...
please, yes, because I don't... Yes.
Okay, thank you. No, just well, I think the three questions. The first of them has a very straightforward response, and indeed these resources are useful and important and relevant. I was asking about the evidence and if there are training materials, and then you told us a bit more on that, because initially I had it seemed to me that it was more focused on the development of the messages and a public information approach, but now I see that you go farther than that, and we need to discuss about the platforms. I think that's the critical point for us. We need to look at platforms that have the capacity to have dialogue with people, with whether with individuals, with families, or with communities. For any platforms where interpersonal communication or counseling can take place are absolutely relevant. And this is why for us, for implementing, for disseminating this, apart from all these new technological solutions and dissemination, or even from more traditional one-way communication is important and it has to happen. But the next level is the level of really behavior change, where we need to have a capacity to accompany the people as they struggle and they identify the bottlenecks and the challenges they have, and we put people together to share their experiences and to learn one from each other. And I say this as a professional, but also as a citizen, because as a parent. So I think that my own experience tells me how important it is to have these forums to get feedback, to express my concerns, and this is the way we can evolve in adopting these practices. And this is why these community health workers, social workers, even teachers, to the extent that they also have an important role in the communities, and other actors need to be exposed not only to the messages, to learn about the messages, but they need to have certain skills. And this is work that the colleagues do at country office. So in principle, what we always aim at is to having platforms that are equipped to conduct quality dialogue or quality counseling. And then once we factor new information and with resources, they are able to deal with them. So this is the approach, but it's not always evident. So I would suggest that it's important to pay attention at what is the level of capacity to do this when we disseminate. And we may find places where the people have the right capacities, the right skills, and other places where we should couple this with soft skills training. So this mapping and this assessment of the capacities is very important. Now we're looking at COVID, we know that having group meetings may be an issue, but I would say not to take this for granted as something that is given in every single country or in every single setting, because there are activities that take place respecting physical distancing and mask and other measures. And at the end, even if we are challenged by the possibility of doing group activities, there is also the individual counseling that is absolutely important. That's the first point. Well, a number of points, so sorry, I will try to speed up. A second thing is on the adaptation. The adaptation is important. It's not only translation, it's adapting the messages, and even sometimes to the possible extent by using participatory processes where people even orient us and which is the best way to say this, or which is a practice that is feasible in a given context, or what is the cultural aspects that can be related to that practice. And this is how we also can tailor messages. So adaptation based on participatory to the possible extent, and based on an analysis and a strong understanding of the context is also essential for dissemination. And the very last point is on the challenges. I also already mentioned this aspect of the interpersonal communication, what may happen now in the COVID context. I could say also that another important element is the complementarity. I mean, how these come to be part of larger programs that are looking at this adoption of these parenting practices, because we may have factors that are not addressed by these tools. And we are adopting, increasingly adopting here a model that we call the behavioral drivers model, when we look at put together a lot of around 30 theories of behavior change, and look at as a guidance for doing formative research, for designing surveys, and for identifying in a given context what are really the factors that are having a more weight. And this clearly fits into a number of important factors that are in this, let's say, agnostic model. But we may find many other situations, and especially I'm thinking of social norms related situations, where we really need to engage the community in a different manner. And as we are not expecting these tools to address all the different possibilities, all the different situations. But what I'm saying is that for adaptation and for adoption in a country, this may need to be part of a multi-layer strategic approach, where you may have, I don't know, for instance, when I think of parenting and violence and the use of violent discipline, social norms may be at the stake in a very, very important manner. And this requires community action, and these are different dynamics. So again, it's not asking you to address that, it's just more for you to be aware that parents may have the skills, may have the knowledge, may have the counseling, and this works at the individual level, but at social and societal and community level, our colleagues and country offices, they may need to look for other complementary interventions. Over.
Thank you, Ron. Very, very, very relevant and interesting points to think about, to keep in mind, and based on your experience in work. Yes.
A very last point on the platform, sorry, but I think this is
Yes,
very relevant.
yes.
There is a global partnership, and I don't know if you have discussed this with HQ colleagues, with the Religions for Peace, and they have, in most of the countries in the regions, they have interconfessional platforms through which work is being coordinated and packages are being developed for working on different topics. I think that parenting is on the pipeline, so I will immediately also make them aware that this specific package for religious leaders exists. And at some point, if you want, we can set up a discussion with our regional interlocutors. And now, over forever, definitely.
Thank you so much.
Thank you.
You can stay on one.
So maybe I know that the team is also collaborating with our C4D team at HQ, maybe the EPD team too. But you can, I don't know if you will have time to let you maybe talk about that a bit. But I have Narcis wanted to come in, and maybe one other country colleagues to share your experience or your thoughts in how these tools could be relevant for your program's implementation or your COVID-19 response before giving the floor to the presenters. Over, Narcisse.
Merci Alinta, merci tout le monde. Moi, je vais adopter en fait une perspective pays parce que j'ai appris beaucoup de leçons du Bénin d'où je viens et que je voulais partager ici. La première leçon, je ne sais pas si vous avez invité les gens de protection aussi, parce que ce type d'intervention...
Ils étaient invités.
Ok. Parce qu'au Bénin, ils ont eu beaucoup de difficultés pour introduire dans la réponse COVID des aspects comme les violences domestiques. Et le gouvernement, leur ministère de tutelle des Affaires sociales a complètement résisté. Et je vois l'intérêt que je vois dans les produits ici, c'est que il y a différents aspects qui peuvent servir d'angle d'attaque. Attaque, c'est un grand mot, et qui peuvent être plus acceptés au départ par le partenaire gouvernemental qui contrôle tout là-bas. N'importe quelle production de messages est centralisée et doit avoir la clairance. Donc, ça a un avantage, mais il faudrait donc s'assurer que les collègues de protection soient associés. Deuxièmement, je pense que l'une des leçons qu'on a vues avec les gens qui sont dans le nord de Bénin, comme Karimama ou Ndali, ils n'ont accès ni au téléphone qui fonctionne, ni aux réseaux sociaux, et même pas de radio communautaire dans certaines villes. Et ce qu'ils ont souhaité, c'est vraiment que les méthodes traditionnelles comme les groupes d'écoute, même si, je crois, comme on l'a dit, en respectant les mesures barrières, qu'ils aient accès à ces ressources-là aussi par des méthodes traditionnelles, parce que c'est les seules méthodes traditionnelles qui leur sont accessibles, et c'est ce que, en tout cas, les gens sur le terrain utilisent. Et ça m'amène à un point qui est crucial, c'est vraiment le lien et la collaboration avec les autres intervenants au niveau communautaire. Parce que même au niveau de la capitale, où il y a beaucoup de mécanismes de réseaux sociaux, des différentes plateformes, c'est une confusion totale. C'est-à-dire chacun essaie d'inonder le terrain d'informations, de messages qui ne sont point suivis, et à aucun moment on ne peut faire le point de dire quand est-ce qu'on a fait ceci, pourquoi, etc. Et ne pas garder, ma proposition est donc de vraiment associer à ce travail-là tous les autres partis, ou surtout les ONG qui sont en interaction avec ces mêmes parents dans des groupes plus organisés et qui pourraient utiliser ces ressources complémentaires ou en tout cas le contenu des messages pour pérenniser et faire le travail et suivre le travail sur le terrain. Enfin, il me semble qu'on a parlé de traduction. Je pense que Translator Without Borders est l'un des partenaires qui ont bénéficié de dernier LTA avec l'UNICEF. Il faut vérifier. je sais qu'en RDC, ils nous ont beaucoup aidés à traduire très facilement dans les langues nationales, nandais, différentes sortes de langues nationales, des messages. Et ils faisaient même partie de l'équipe de la commission nationale de CREC, de communication et mobilisation. Donc, c'est peut-être une opportunité que l'UNICEF peut explorer si vraiment, il faut confirmer, hein, il me semble avoir vu leur nom sur la liste des derniers LTA. Merci.
Merci beaucoup, Narcisse. C'est très intéressant d'avoir cette perspective du terrain que tu connais parfaitement. Je ne sais pas, je crois que ça répond un peu à la question de Sabine pour entendre un peu en quoi est-ce que ça peut être utile et comment ça peut être pertinent pour notre région. Est-ce que, Sabine, je te laisse faire un résumé aux collègues ou bien peut-être rapidement, si tu veux réagir. Sabine. Sinon, j'ai Bourema qui voulait parler. Non. OK.
Oui, en fait, comme il y avait eu la question de savoir quelles sont les ressources qui ont été utilisées pour faire ce kit, je voulais réagir là-dessus.
Oui.
C'est notamment les ressources de l'UNICEF, de l'Organisation internationale du travail, de UN Women, mais aussi des ressources COVID liées à l'OMS ont été utilisées également.
D'accord.
Voilà. Donc, c'est quelque chose d'intersectoriel.
OK.
Voilà.
D'accord. Donc, parce que ça, c'est des ressources aussi développées avec l'OMS et l'UNICEF. Merci beaucoup, Bourema.
Non, c'est-à-dire les ressources qui ont été utilisées pour élaborer ces kits.
OK.
Le kit a été fait à l'UNICEF, oui.
C'est ça, d'accord.
Merci.
OK, merci beaucoup. So just quickly, Narcisse was saying that from his experience in Benin in dealing with the COVID-19 response, he feels that it might be like useful and relevant to see how to engage more with child protection colleagues and to use these tools, because he's seeing a link and between these tools and what they are doing on the field. And also because they were struggling to talk about coping with stress and mental health support. And also he said that he thinks that we should also, talking about contextualization, see how to not only use like audio and broadcasting the messages through audio messages and video, but use the existing traditional mechanism of grouping people in small teams to talk about their daily issues and talk about their needs, like and of course in respect to all the protocols and related to COVID, but some people in our region still use this traditional way of broadcasting messages and discussing and at community level. So let's see also how to use these groups to talk about mental health and stress and parenting. And also for him, we need to keep in mind and engage also with local civil society, some more formal existing community-based groups who do a lot at the community level to support communities in dealing with the problems and the daily issues, but they can also be very active in supporting parents and in these in their role. And finally, talking about translation, he said that at global level, UNICEF has a partnership to be confirmed with Translator Without Border that you have mentioned. And he said that we could use this partnership as UNICEF in the region to translate the tools in the language that we feel important or relevant for our region. So I will maybe give you the full floor to talk about how you have been partnering with UNICEF in other countries, in other regions, and how you see the way that we could work with you in support of the countries here based on what they have said and the interest they have expressed.
Great. These are such amazing, very relevant and helpful comments. And I want to first of all thank everyone. Thank you, Helinta. Thank you, everyone who's made the comments. They are so helpful and so relevant. And because I know that we don't have so much time, I'm just going to say a few things, and then I'm going to hand over to Rachel to comment more about how we have been partnering with UNICEF in other areas, because I'm just leading the work in West and Central Africa, and Rachel knows more about what we've been doing in other areas. But I would like to say that, just make brief comments on some of the comments on some of the things that have been said, about using traditional methods, where people gather together. So that's something that we have been doing with the partners, with the NGOs that we partner with. Like we had in Cameroon, we had a particular partner. He had meetings with mothers and shared these tips with them. And from the meeting, he had complaints that they would like to see the fathers more involved in parenting. So subsequently, he organized through a church to get fathers together. So and then he was able to share these parenting tips with them. So we are also having people not just use radios and social media toolkits, but we also have that they're meeting with small groups to share these resources and get the message going on. And in terms of, we totally agree about contextualization, and in terms of capacity, one of the things I think I did mention that earlier. We do realize that in some places, and we've had that experience with our partner with the partners, with the NGOs that we are working with, that in some cases, we need to support by helping them to train volunteer workers. And I would like to emphasize here that we are open to working with you, on whatever, and supporting in whatever way we can, both in training resources, training volunteers, whatever is needed, and then helping to adapt this to your own context, to make it usable and usable in your own context. And have I left out any key thing? Oh, I'm really excited about the translation, yes. And I think what I jotted down there was, I'd like to know who we can reach out to. And I'm really hoping that the conversation today will not just end with this webinar, that we'll be able to work with you, with the individual, with the different country offices to move this conversation forwards, to partner with you. But I really want to let you know that we're open to adapting this to your context, and we are excited about the different possibilities. Rachel, could you please comment on how we've been partnering with UNICEF in other areas, in other places?
Sure. Hi, everyone. Thanks, Isang. It's great to tag team with you. And as Isang mentioned, we work closely together, but I'm working at the global level, so I have some more awareness about partnerships with UNICEF and other places that you might be interested to hear about. Actually, UNICEF has been a critical partner since the beginning of the initiative, and even helped to create, validate, and then begin disseminating all of our existing resources. So that from the tip sheets to social media engagement to radio work, it's really been done at the global level with inputs from UNICEF HQ colleagues, including in C4D, ECD, and child protection, as well as some other streams of work, and has also been informed from the country office and regional office level. And in some countries, we're doing more intensive work in partnership with UNICEF country offices. So one example is, Isang mentioned our parent text initiative. This is the phone text message-based support for parents, where they receive parenting messages as text messages on their phone, and that can be written text messages or video messages that they receive as a text message. And everywhere where we're delivering those messages, or beginning to pilot the delivery of those messages, we're working in partnership with UNICEF country offices to do that. The UNICEF offices are actually using Rapid Pro, or the same software that's used for the U-Report programs, in order to deliver the text messages free for use for parents. So that's a critical partnership that lets us be able to send text messages that are free for parents to parents. But it's also that we receive cultural and technical assistance from those UNICEF country offices as well. So they help us think about how to tailor and adapt the messages to be appropriate for context. I know there were some questions on the chat box about examples of contextualizing messages together with the UNICEF. And one example that came to mind is in Malaysia. We're working with the government of Malaysia and UNICEF Malaysia to pilot and ultimately scale up our parent text initiative. And our UNICEF colleagues have been really critical in helping us review our script for text messages and update it to make it more contextually relevant. Because we have created a global set of text messages that do need to be tweaked and adapted for different contexts. And for example, in Malaysia, our colleagues told us we had a recommended activity for parents of young children to dance with their children, and it was seen as culturally inappropriate to dance, even with very young children, and perhaps even like an immodest thing to do. So we worked with the UNICEF country office there to develop new activities that parents of young children could do with their children that don't require any toys, that just require your bodies, that would be culturally and contextually relevant there. And that's just one example of one type of dissemination strategy that we're working on in partnership with UNICEF there. Is that helpful? Would people like to hear other examples of work with UNICEF in specific country offices?
No, I think it's okay. I think it's good. Maybe they can continue the bilateral review, and because I've seen Mali expressing the interest of being supported to work on the caseworkers tools, but more in support to teachers' well-being and mental health. And maybe we of course we will share all reshare the tools and the links and the record of the webinar with the country teams and see what the interest and will be. I think this was what we discussed, and you discussed also with Cecilia. I don't know if you have any other.
Maybe a couple of things,
yes,
maybe.
Please.
Maybe just to add, listening to Narcisse and colleagues, I think there are a couple of things about the parenting work that are important to situate. And that is that, as you all know, the parenting work in UNICEF is not implemented in isolation from our efforts in anchoring our work in the early years, yes, or even the adolescent years within a coherent multisectoral programming framework. And so in areas or countries or regions where multisectoral programming has been a challenge, I think we have to continue to strengthen the evidence base that multisectoral programming has value addition, and to show that through ongoing research and mechanisms that can actually build, if you like, a constituency for adopting a holistic approach to responding to the needs of children in the early years. So I cannot overemphasize the importance of breaking the silos, but also using research as a way of helping to show evidence of multisectoral programming, the impact of multisectoral programming approaches. The second point I want to make, and I believe, you know, the research, perhaps that could be another area of collaboration that one can explore further. The second issue concerns one's point about platforms. What I can say to that is that we need to have a diversity of platforms. Because often when we talk about reaching parents in sharing skills and helping them develop competencies in parenting, we often think of them as being at home or huddling in small groups, but these are busy people. Parents are busy people. They're in the markets looking for means of survival. They are in, you know, in different locations, doing different things. And the best part of their time is often not necessarily available for learning. And so we program people need to be more and more adept at understanding where those spaces are that parents can actually be reached for learning. As I look these days in the social media, you go into Facebook and you're watching a little clip, and then all of a sudden you see a pop-up marketing gimmick for 1 split second, gives you a message and then disappears. And you learn something from it in that split second. And when I look at that, I ask myself, so where are we with our education messaging that actually can do something like that with people who are busy? So the private sector has done well in showcasing what is possible, in helping us to understand the different ways by which we can be disruptive of the lives of parents in a way that can help them to learn as we disrupt their time. So I think we need to think outside the box about platforms, about where we should reach parents in order that they can learn what we want them to learn. Thank you so much. This was a very, very useful presentation and discussions.
Yes, yes, indeed, it was. Just to complete that, I remember that in the beginning of our discussion with Rachel, I also mentioned that maybe it will be interesting if we could have some parenting tips for homeschooling support. Like just to orient parents on how the child, depending on the age, learns, and how the parents could create an enabling and positive and environment for the child to learn, depending of the age. That could be also something very useful to deal with the actual context of COVID-19 response. Over to you, I think, because you wanted to speak.
Yes.
Alenta, just a quick point on this part of the discussion. On the intersectoral side, if it is possible to connect with the external communication team too,
Yes.
since they have been working hugely on this question of parenting during COVID.
Yes.
There are a number of tools that can be available from their side.
Okay.
Thank you.
Yes. Good suggestion, Burema. Thank you.
So I want to say again, thank you, Helinta, and I want to thank Cecilia for those comments. Thank you so much. I totally agree with everything you said. And I'd like to just make 2 brief comments to respond to what you said. I think I should start by emphasizing that everything we have is evidence informed. So we have colleagues who have been working on parenting. We have this Parenting for Lifelong Health program, which is a suite of parenting programs that were developed many years ago in partnership with UNICEF and other organizations. So the programs, the parenting programs, they were already trialed. They went through randomized trials, and they were found to be very effective. So the parenting resources we have now, they are actually evidence informed. I should have emphasized that more and more, but I did mention that. So everything we have here is evidence informed. And we totally agree about the need for that, and even collaboration in terms of research. Then in terms of using different platforms, I think that's another very critical and important point that you have raised. And maybe because I had such limited time, I should have emphasized more that we have a parenting app. We realize that a lot of parents these days are very, very busy, and that we need to think of non-traditional ways to meet them, that we can reach them. So we are, even for the COVID parenting resources, we have a COVID parenting app, and we are working on another parenting app that is even beyond the COVID period. And we have a social media page. We have we are also using different social media platforms. So we have a Facebook page, and we're also using Instagram and Twitter. But I'm glad that you mentioned this, about having the messages every now and then, because it's something that we need to work on more frequently. Thank you.
Good. Last word from your side? Something to complete from Rachel or the other colleagues? Sabine?
We also have Lara and Bridget on this call. We have our colleagues, Lara and Bridget, and interestingly, they both speak French.
Okay, good.
Yes, I just wanted to say thank you so much for this opportunity to connect with you all, and especially to learn about the particular needs in your contexts, and for these beautiful questions and comments. Like, I very much agree with everything that's been said, and it truly helps us understand better about what's needed and how to continue to try to provide necessary supports. And as Isang mentioned, we hope this is just the beginning of a conversation. We know this is a lot of information, and that each of you operate in very different contexts where there's a need to explore, what does this general information mean for the places where you work and the families you work with? And we would be very grateful for the opportunity to have those conversations with you. And as Isang mentioned, we're lucky to be joined by Lara and Brigitte, who are both French speakers. So if you're a French-speaking country, although Isang and myself are more comfortable working in English, we can connect you with French-speaking colleagues. And we're very happy to answer any remaining questions you have, explore opportunities to work well in your context. And just to say again, all of the resources are completely open source. All of them have been created in partnership with UNICEF. All of them are free to adapt and tweak and use as you see appropriate. So we just want to make them available to you if they can be helpful to you in your existing work with parents and with the systems that support parents.
Good.
We are available and open to working with you further. Please don't hesitate to reach out.
Okay, we will share your contacts with the teams. Thank you so much again for your interest and availability today. We have learned a lot. I think we had a rich and very interesting discussion. As you said, it's a starting point. We will continue from the regional office side, but also I think some country offices hopefully will be interested to continue discussions with you. I know that we will need to engage more strongly child protection colleagues. I've not seen them today. Maybe they were busy, but we will make sure that they're also aware and be interested in reaching out. Thank you so much, everyone. I thank Rachel, Sabine, and Cecilia, and everyone for joining and staying with us until now.
Thank you.
We continue exchange through emails and calls. Thank you. Bye.
Thank you. Thanks so much.
Mali,
Thank you.
Chad, DRC,
Bye-bye.
Nigeria.
Thank you so much, everyone.
For
Thank
joining.
you. Thank
Thank you
you.
for joining. Bye. Merci
Bye-bye.
beaucoup. Merci beaucoup.
Okay, bye.
Merci
Thank you.
beaucoup.
Avec
Thank
du
you.
Burkina,
Thank
du
you,
RDC,
Sang.
du Mali,
Yeah.
du Nigeria, de partout. Merci.
Thank
Et de
you.
WCARO. Merci. Merci, Cécilia.